Hello, I'm Craig Cummins. I'm a shoulder specialist with the Illinois Bone and Joint Institute. And what we're doing here today is we're putting together a series of video segments to take you through a home exercise program from the first day after surgery all the way to getting back to whatever activities that you want that to be. So it'll start with very simple exercises and progress through 6 phases to more strenuous exercises. A couple caveats I think I should point out is that these are going to be based on generalized timelines from after surgery. Now that can vary quite a bit depending on what the shoulder problem is, what the surgery is, and what your shoulder surgeon wants to do. For instance, if we do a simple arthroscopic debridement for a frozen shoulder, we're going to progress you along much faster. If we do a repair for a large rotator cuff tear or you have a complicated shoulder replacement, it's going to be a much more conservative program. So I hope these exercises help you, but definitely check with your shoulder surgeon to see what exactly they want, as well as your physical therapist. At this point, we're going to move forward with the phase 1 exercises. This is the initial period following your shoulder surgery, usually lasting around 0 to 2 weeks. Usually we'll start this phase of exercises the day after surgery, but tend to wait until after your nerve block is worn off so you have a little more control of your arm. Typically, patients will be in a sling. How long you're in a sling can vary for anywhere from a few days or a couple weeks after surgery to 6 weeks after surgery for larger rotator cuff repairs. And I think it's important for you to check with your surgeon so you know exactly what your restrictions are moving forward and how long you need to be in the sling for. Some common questions we get asked after surgery are what you can, what you can't do, how long you need to wear the sling for, when you can take it off, for example. Generally, you want to be in the sling for most surgeries most of the time. Now, if you're just sitting in a safe position like this and you're watching some TV, you can take the sling off. In fact, it's probably good to. Sometimes it helps with the blood flow and the swelling, draining off your arm and your shoulder. It can help with your elbow, getting some motion going there, and avoid irritating a nerve behind your elbow as well. Of course, you can take the sling off for showering. I would say be careful. You don't want to slip and fall in the shower. You're generally not driving for at least a couple weeks after surgery, so at this point, that's not an issue. You can take the sling off when you're, for instance, eating food. I don't want you lifting more than a glass of water with that arm, and that's usually down here. Usually you're going to use your other arm. I don't want you lifting your arm up overhead either, right? So everything's kind of more with your arm at the side, but you can use it to maybe help cut your food a little bit. Some people can get back to doing work on a computer. You're not going to feel like it for the first few days following surgery. You're not going to be able to reach up to a keyboard, but if you have it down low, you'll probably be able to work slowly and do some work. A couple challenges after surgery. Sleep is often difficult for people. It's preferable after most surgeries if you wear the sling at night when you're sleeping. In general, you'll find it easier if you sleep in a more upright position. A lot of patients will sleep, for instance, in a recliner chair, whether that's for a couple days, sometimes a couple weeks or more, or in bed utilizing a lot of pillows to kind of prop you up. So with that introduction, we're going to move on now to the phase 1 shoulder exercises. As you can see, we have our patient here wearing her sling after surgery. This is a type of sling that has a bump there that holds the arm a little bit away from the body, and that can have some advantages after certain shoulder surgeries. Some slings won't have that. If it doesn't have it, it's likely not necessary after your surgery. A few things, though, when you're wearing the sling. You really want it to rest comfortably at your side. You want your arm at a 90-degree angle, and this bump kind of sits flush against your body. Now, when you do your first exercises, again, it's ideal to wait until the nerve block is worn off so that your arm's not floppy, you have some motor control over it. And then you're going to get very proficient at these slings where on your own it's going to be easy to take on and off. But the first time you take it off, you may want to have someone help you. And generally, they're all a little bit different, but they have little clips here. This one will have a clip around the waist. And then there's a few little, these are all based on a lot of Velcro straps. So you might want to free up the hand. And there's another strap here, kind of holding the sling closed. And then you're going to support the arm as you take the sling off. Now some of these fancier slings come with an exercise ball. And I'll have our therapist show you some things you can do with this. These generally get lost within the first couple days after surgery, but try to hold on to it.
So the first exercise that we're going to show you is going to be called the scapular retraction. So what you're going to do is...
Patient is going to squeeze their shoulder blades together, keeping shoulders down, nice and relaxed. Make sure you're just moving your shoulder blades, you're not moving your whole arm.
And then the next exercises we'll go through is elbow flexion and extension. So you're going to bend the arm up and down.
Same thing, you want to keep your elbows next to your body. This should just be the elbows going into flexion and extension. Nice and gentle next to your body.
And then the next exercise will be wrist flexion and extension and supination and pronation.
You can hold your arms up like that, just bringing the wrists into flexion and extension. You can also set them down on your legs, nice and gentle, just moving the wrists.
And then the last one will be the little ball that you have in the sling. You can go ahead and squeeze that to do a little bit of grip strengthening.
And with this one, just keep your arm relaxed against your body. You don't have to hold the ball up. You're just doing repetitive gripping exercise. The next exercise that we want you to do out of the sling are our pendulums. The pendulums can be done a couple different directions. You can do circles, forward, backwards as well. So with the pendulums, the big thing to pay attention to is that your arm is just dead weight hanging down from your shoulder. You should be using your body to circle your arm around. Start with really kind of small circles, and then as you get going, you can make them a little bit bigger. At no point during this exercise should you be actively using your arm to make the pendulums. You should be using your body. You may have been sent home after surgery with an ice pack. Feel free to use this both after you're done with your exercises and frequently throughout the day the few days following your surgery. You can put the ice pack right over your shoulder. Make sure that there's a layer in between the ice pack and your skin. Otherwise, if you put it directly on the skin, it may cause frostbite. Typically, it's good to leave the ice pack on for 10 to 15 minutes at a time and then remove it. You may feel yourself using it less frequently as the days go on, but immediately after surgery, it's a good thing to use throughout the day.